my name is Fiona Healy, chartered physiotherapist specialising in pregnancy and postnatal. And today I'm just going to take you through a few stretches that can help with the symptoms of carpal tunnel in pregnancy. So carpal tunnel is pain or tingling or numbness in your fingers and hands. So we'll start off in sitting. You can sit in a gym ball, a chair, on the floor, just a comfortable sitting position, but we're going to sit nice and tall, so you're looking for length in the spine. Sitting bones on the ball or the chair, shoulders open across the front and length through the back of the neck. We're going to start off by taking our elbows in by our sides, palms facing towards the ceiling. And we'll just start by opening up the front of the shoulder, so you're reaching out and you're coming back in. A very simple exercise to start, just opening the front of the shoulder. From there we'll reach the hands out, turning the palms down and bring it back in. As you're reaching your hands out and down, turning down, you're looking to keep the space between the shoulders and your ears. So you don't want to see that space squashing, because the nerves that supply the carpal tunnel originate in your neck and upper back. Now, at the end this time, we're just going to add in a little extra stretch. Now, might be a little bit much for some of you, but you're taking your wrists into extension and then reaching down. So we'll just do 3 and come back in. So you might find a good pull into the hand. Don't force it. It's really important that this is just a smooth movement. And if you're feeling a lot of pain, just ease off, back off. Don't force this one. Coming back in. So external rotation again, reaching out, palms down, reach up and down, up and down, and coming back in. If you're already feeling it at this point and this is just too much, then just stop. There's no need to do the up and down with the palms if you're feeling it already with just the arm straight. So especially if your symptoms are quite intense. And we'll just do one more of those. Coming back in. From there, we're going to take it into prayer stretch. So with prayer stretch, you have your palms together, thumbs in line with your breastbone, shoulders again nice and open at the front and down and away from your ears, so length through the spine. You'll take a breath in, and as you breathe out, you're just going to rotate around, keeping the thumbs in line with the breastbone. Breath in to hold and breath out to return. Breathing in and breathing out. Breathe in again to hold and breathing out. Breathe in again to prepare and breathe out. This is a nice one just to add the breath to, because you get a little more expansion through the rib cage, so it helps loosening out with the upper back. If you want, you can take it into a longer lever, so as you rotate, you can just reach the arm back, so you'll feel a little bit more of a stretch along the arm. But if you're already feeling a stretch in this position, you can leave it coming back to center. I'm going to reach around to the other side. And again, if you want, you can add in the arm length and come back in. And now you can just reach your arms back down. We'll take it from here just to an upper back stretch. So you're going to reach the arms forward, taking the palms together, head down, and then you're just going to open out the arms, taking the wrists into extension and just opening out the front of the chest. So again, you might feel it just running down the arms, and that's okay, but again, don't push into it. So reaching forward and then reaching open. we just do one more of these. The last thing that I'm going to recommend is draining the carpal tunnel, so draining the hands, because you'll often find in a lady who's experiencing carpal tunnel, the fingers will be quite swollen. The tunnel itself, where there used to be a dip, can often be raised or flattened out, so no dip going in here. So trying to drain all the fluid out is a really good idea. To drain the fluid, the arms would need to be higher than your shoulders though, so you'd need to be up here. Putting an ice pack, so something like a bag of frozen peas wrapped in a damp towel on them before you do this, is a good idea as well. Now it can be hard to hold your hands up here, but it is more effective than having them down here trying to drain them. You want to drain them right down and get as much fluid out of them as you can. So obviously take breaks when the arms get tired. But doing this maybe for 5 minutes before bed, on and off, can really help with the symptoms at night, because they often can be most severe at night. If these stretches are not enough to help your symptoms, you should consult your local chartered physio, because there are splints that you can wear at night that can help, and also with desk work that you could wear them then to help alleviate the symptoms, and these exercises can be combined then with the use of splints.